Shoulder dystocia is an obstetric emergency in which one or both of the baby's shoulders get stuck during delivery. And some of the risk factors for this are most obviously, I suppose, macrosomia. So if the baby is quite big, they may get sort of stuck along the way, and things that can increase the risk of macrosomia as well. So, for example, if the mother is diabetic or they've developed gestational diabetes, that can also increase the risk of having a macrosomic baby and hence having shoulder dystocia as a complication of their delivery. So shoulder dystocia is a problem for both the mother and the baby. So given that the baby isn't passing through the birth canal the way that they should be, it causes a huge degree of trauma on the way out, and especially perineal tears. It can also increase the risk of postpartum hemorrhages. For the fetus, given that their shoulder has got caught and there's essentially traction being applied to their arm, they are at increased risk of developing a brachial plexus injury, such as Erb's palsy. They may fracture their clavicle, and in severe cases, it can also compromise their blood supply to the extent where they get some hypoxic brain injury. The management of shoulder dystocia is very step-by-step. So first of all, the patient should be advised to stop pushing, and again, senior input early on is absolutely essential. The second step is something called McRoberts maneuver, which is successful in the vast majority of cases. So it involves, with the help of midwives and doctors, hyperflexing the patient's legs and trying to create an easier passage for the baby to be delivered. Suprapubic pressure can also be applied to try and ease the baby out, and if that's not effective, then an episiotomy should be considered to make a little bit more space for delivery. There are a few other maneuvers that can be tried as well, such as a Rubin 2 or wood screw. Then, if that's not successful, the patient should be positioned on all fours. If none of these measures have worked, then you might consider more extreme options, such as a symphysiotomy, which involves dividing the patient's pubic symphysis. A cleidotomy is a procedure in which you forcibly break the clavicle of the baby to try and get them through the birth canal. And a Zavanelli procedure is essentially when you push the baby back into the uterus with the plan to take them to theatre and deliver the baby via C-section.